Good afternoon, and thank you for the opportunity to present my Doctor of Nursing Practice scholarly project titled Implementing Hourly Rounding to Reduce Falls in Institutionalized Older Adults. This project focuses on improving patient safety through a proactive, evidence based nursing intervention. Falls remain one of the most common and preventable adverse events in healthcare, and this project aims to address that gap using a structured and sustainable approach. I would like to acknowledge my DMP committee, including my chair, Dr. Maria Snell, my second reader, faculty from N705, and my community member. Background and significance. Falls are a leading cause of injury among adults aged 65 and older, with approximately 1 in 4 older adults experiencing a fall each year. In healthcare settings, particularly in long term care and institutional environments, patients are at even greater risk due to factors such as decreased mobility, polypharmacy, cognitive impairment, and multiple chronic conditions. Falls are associated with serious consequences, including fractures, head injuries, loss of independence, and even mortality. Additionally, falls significantly increase healthcare costs and length of stay. Because of this, fall prevention has become a national patient safety priority and is closely monitored through quality metrics and regulatory standards. Problem statement. At the project site, fall rates consistently remained above organizational benchmarks despite the implementation of standard fall prevention strategies. Upon further evaluation, it became evident that many of these interventions were reactive, such as responding to call lights or implementing precautions after a fall had already occurred, rather than proactively preventing falls. Additionally, rounding practices among staff were inconsistent, leading to unmet patient needs such as toileting, repositioning, or pain management. This inconsistency created a gap in care delivery, highlighting the need for a standardized, proactive approach to reduce fall risk. Purple, purpose and clinical question. The purpose of this project was to evaluate whether implementing a structured hourly rounding protocol could reduce fall rates among institutionalized older adults. The clinical question guiding this project was: in institutionalized older adults, does the implementation of hourly rounding reduce fall rates compared to usual care? This question is important because it focuses on a practical, nursing driven intervention that can be implemented across various healthcare settings. Review of the literature. A review of the literature demonstrates strong support for hourly rounding as an effective fall prevention strategy. Studies consistently show that hourly rounding can reduce fall rates by approximately 20 to 50%. Additionally, hourly rounding improves patient satisfaction by increasing perceived attentiveness and responsiveness of nursing staff. It also reduces call light usage, which reflects a decrease in unmet patient needs. The use of the 4 Ps, pain, positioning, potty, and possessions, provides a structured framework to ensure that key patient needs are addressed consistently. Overall, the literature supports proactive, nurse led interventions as essential components of fall prevention. Theoretical framework. The Plan, Do, Study, Act framework was essential in guiding this project because it supports real time evaluation and continuous improvement. One of the strengths of using PDSA is that it allows for small, manageable changes rather than large scale system disruption. During the plan phase, I worked with stakeholders to identify workflow gaps and tailor the intervention to fit the unit's needs. During the do phase, implementation was intentionally structured but flexible, allowing staff to adapt while maintaining fidelity to the protocol. The study phase was critical as it allowed for ongoing data review and identification of barriers, such as documentation burden or workflow inefficiencies. Finally, in the act phase, adjustments were made to improve sustainability, such as simplifying documentation and reinforcing expectations. Overall, this framework ensured that the intervention was not only implemented, but continuously improved and aligned with clinical practice. Methods and design. This project used a quality improvement design because of the goal was to improve an existing process rather than generate new generalizable knowledge. The pre and post intervention design allowed for comparison of outcomes before and after implementation, providing a clear picture of the intervention's impact. One of the key strengths of this design is that it reflects real world clinical practice, making the findings more applicable to everyday nursing workflows. Staff education was a critical component of the intervention, as it ensured that all team members understood the purpose, expectations, and benefits of hourly rounding. Additionally, ongoing audits and feedback loops were incorporated to enforce compliance and provide opportunity for continuous improvement. This approach ensured that the intervention was not only implemented but also sustained over time. Sample. The sample consisted of institutionalized older adults aged 65 years and older who were identified as being at increased risk for falls. The project also involved nursing staff, including registered nurses, licensed practical nurses, and nursing assistants, who were responsible for carrying out the hourly rounding protocol from the AHRQ 3B protocol. This interdisciplinary involvement was essential for successful implementation. Data analysis. Data analysis included descriptive statistics such as means, percentages, and rate calculations. Fall rates were standardized per 1,000 patient days to allow for accurate comparison between pre and post intervention periods. Pre and post intervention comparisons were conducted to evaluate changes in outcomes. Rate ratios were also calculated to assess the magnitude of change. Due to the limited sample size, the focus was placed on clinical significance and trend analysis rather than statistical significance alone. Fall rates. As shown in the results, fall rates decreased from 5.2 to 3.8 falls per 1,000 patient days, representing a 26.9% reduction. Rounding compliance improved from 62% to 88%, demonstrating successful staff adaptation of the intervention. Additionally, call light usage decreased by 33%, indicating that patient needs were being addressed proactively rather than reactively. Together, these findings suggest that hourly rounding had a meaningful impact on both patient outcomes and workflow efficiency. Although the results were not statistically significant, they were clinically meaningful. The consistent improvement across multiple measures supports the effectiveness of the intervention and aligns with findings from the literature. This highlights the importance of evaluating both statistical and clinical significance in quality improvement projects. Limitations. While the project demonstrated positive outcomes, several limitations should be considered. The relatively small sample size limited the ability to detect statistical significance, which is important when interpreting the results. The short duration of the implementation period also limited the ability to evaluate long term sustainability and outcomes. Additionally, because this was a single site project, the findings may not be generalizable to other healthcare settings with different patient populations or workflows. Another limitation was variability in staff documentation, which may have impacted the accuracy of compliance data. Finally, the absence of a control group limits the ability to establish causality, as other factors may have influenced the outcomes. Despite these limitations, the project demonstrated meaningful clinical improvements that support the value of the intervention. Discussion. The findings of this project suggest that hourly rounding is an effective strategy for improving patient safety through proactive care. By addressing common patient needs such as toileting, positioning, and pain management, nurses can prevent situations that often lead to falls. This shift from reactive to proactive care is a key factor in improving outcomes. The results also highlight the importance of consistency in nursing practice, as standardized workflows lead to more reliable care delivery. Additionally, the reduction in call light usage suggests that patients' needs were being met more efficiently, which can reduce staff workload and improve overall workflow. These findings are consistent with existing literature and reinforce the importance of evidence based interventions in nursing practice. Implications for practice. This project has several important implications for nursing practice. First, it reinforces the role of nurses as key drivers of patient safety through proactive, evidence based care. Hourly rounding promotes accountability and consistency, ensuring that all patients receive the same level of attention and care. It also enhances teamwork by clearly defining roles and expectations for both nurses and nursing assistants. From a patient centered perspective, this intervention improves communication and trust as patients feel more supported and attended to. Additionally, it supports equitable care delivery by ensuring that vulnerable patients, including those with cognitive impairment or limited ability to communicate, receive consistent monitoring. Overall, this intervention aligns with the core values of nursing practice, including safety, quality, and patient centered care. Organization impact. At the organizational level, this project contributed to improvements in key quality and safety metrics. The reduction in fall rates supports organizational goals related to patient safety and regulatory compliance. Improved workflow efficiency, as evidenced by decreased call light usage, allows staff to manage their time more effectively and reduce task overload. Staff also reported improved communication and collaboration, which are essential components of a positive work environment. Additionally, reducing fall related incidents has the potential to decrease healthcare costs associated with injuries, extended length of stay, and additional treatments. Overall, this project demonstrates how nursing led interventions can have a significant impact on both clinical outcomes and organizational performance. Sustainability and future recommendations. Sustainability is a critical component of any quality improvement initiative. This intervention is highly sustainable because it is low cost, requires minimal resources, and can be integrated into existing workflows. To maintain compliance over time, ongoing audits, feedback, and leadership engagement are essential. Incorporating hourly rounding into policies, orientation programs, and annual competencies will help ensure long term adherence. Looking ahead, future efforts could focus on expanding the intervention to other units and evaluating its impact over a longer period. Additionally, integrating technology such as EHR, prompts, or automated reminders may further improve compliance and efficiency. Future research could also explore the impact of hourly rounding on additional outcomes, such as patient satisfaction, staff burnout, and healthcare costs. Conclusion. In conclusion, this project demonstrates that structured hourly rounding is an effective and practical intervention for reducing fall risks in institutionalized older adults. The findings highlight the importance of proactive nursing care in improving patient safety and outcomes. Although the results were not statistically significant, the clinical improvements observed are meaningful and align with existing evidence. The project also underscores the value of standardizing care processes to reduce variability and improve consistency. Ultimately, this work supports the integration of hourly rounding into routine nursing practice as a sustainable strategy for enhancing patient safety and quality of care. My personal reflection. This DMP journey has been both professionally and personally transformative. Although this project All through the project, I have developed a deeper understanding of quality improvement processes, data analysis, and evidence based practice. I have also strengthened my leadership skills, particularly in engaging stakeholders, managing change, and promoting staff accountability. One of the most valuable lessons I have learned is the importance of translating evidence into practice and designing interventions that are both effective and sustainable. This experience has reinforced my role as a DNP prepared nurse in driving system level change and improving patient outcomes. Moving forward, I plan to continue applying these skills to lead quality improvement initiatives and contribute to advancing healthcare practice. Overall, this program has prepared me to be a more confident, knowledgeable, and impactful nurse leader.